Dangers of vaping continue to make headlines on a national level and right here at home. 3 Houston teens have recently suffered injuries so severe they were hospitalized. Channel 2's Brittany Jeffers live near the Texas Medical Center this evening with a story all parents need to hear. Brittany?
Well, officials say that all of these hospitalizations happened during the month of August, and all of them involved teenagers. And because of that, officials have a message for parents tonight.
This is a real phenomenon. Parents, you need to look out for your kids, find out what they're doing, educate them that this is dangerous.
A new and serious warning from the Houston Health Department. Within the last month, 3 teenagers had to be hospitalized with what's being called acute pulmonary injury by vaping. Local health authority for the Houston Health Department, Dr. David Purse, says the teens experienced a lung injury and displayed symptoms like shortness of breath, persistent coughing, and unexplained fatigue. Nationwide, the Centers for Disease Control and Prevention say there's been 450 possible lung-related illnesses associated with using e-cigarettes and 5 confirmed deaths. In Texas, the Department of State Health Services reports there's 17 confirmed or probable matches to the symptoms and substance use reported nationally.
It is just the tip of the iceberg. It's going to continue to get worse and worse and worse.
Samantha Boyd isn't surprised. In fact, the founder of StopVape.org says that for years she's been worried this would happen and has actively pushed for regulations and raised questions about the oils and flavors in vaping products. In Houston, health officials say the 3 teenagers should recover, but that number could change.
The cynic in me is concerned that it's going to increase, right? This is why we got to encourage the parents to get ahead of this.
So in Texas, it is against the law to sell tobacco products to anyone under the age of 21, and that does include vaping products. Reporting live, I'm Brittany Jeffers, KPRC, Channel 2 News.
Thank you. Use a vape pen, put it down. They are growing in popularity among teenagers. If you use a vape pen, put it down. They are growing in popularity among teenagers, and now there are growing health concerns.
Yeah, we've been hearing about this. 3 teens in Houston have been hospitalized recently from vaping-related illnesses. Look at the map. So far, more than 450 people in 33 states have gotten sick. This is according to the Centers for Disease Control and Prevention. And 6 people have died from those illnesses.
Our team is taking a closer look at the issue. We start with Chris Costa outside the health department. Chris, is there something in the vape products that is causing this?
Well, Len and Mia, that's exactly the question that health officials here in Houston and the CDC are trying to answer, but they don't have that answer right now. We spoke to one vape shop owner who says he believes there's likely something else that's linking these products to lung damage.
It seems like every morning now there's something on the news related to vaping illness.
Eric Jones says he started vaping 7 years ago to quit smoking cigarettes.
Jolly Ranchers, strawberry lemonades.
Now he owns a vape shop in Houston and believes the nationwide outbreak of lung illnesses are caused by something other than vape liquid containing nicotine.
There's got to be a different component that's causing these issues other than the products that have been out for over 10 plus years now.
So something has changed, and that's what we're trying to figure out.
The Houston Health Department announced Tuesday it's investigating 3 cases of teens suffering lung damage from vaping, saying these are not infections and cannot be treated with antibiotics.
There does not seem to be any antidote, any magic bullet to reverse this.
The health department, the CDC, and other federal health agencies are looking to see if those people who were hospitalized were vaping any other products besides nicotine, like THC.
We don't have the answer to that question. That's one of the things that's so frustrating about this. The bottom line is this is a real phenomenon.
Shop owners like Eric say there needs to be more oversight in the industry to prevent more young people from getting sick.
Until there can be a conclusive study to give you exactly what's causing these issues, we really don't know what can be done. Because if it's a THC component or some other illegal substance, then that shouldn't be happening anyway.
Health officials say they're particularly worried about this rise in lung damage because they say it's predominantly affecting young people. Now they say they're going to go back and look at previous cases to see if any of these symptoms match the CDC's definition for this vaping-related lung illness that's affecting people nationwide. As for those 3 teenagers in the Houston area, the health department confirmed to us late this afternoon that 2 of them have already been discharged from the hospital. They're expecting all of them to make full recoveries. Len and Mia.
morning, the Houston Health Department says those 3 people have serious lung illnesses after using e-cigarettes. And again, that is just in Houston. According to the CDC, there are 450 cases across the country and 5 confirmed deaths. Now, officials haven't pinpointed exactly what's causing this severe outbreak, whether it's the ingredients in the pens, contaminants, or a combination of factors. And that's the big question with the Tomball High School student who passed out last night. What exactly did he inhale? Students and parents were at the school for a choir orientation when the teen had the medical emergency with the vape pen. Here's what one witness saw.
The girl had handed it to him. He hit it, he passed out, and he would not wake up. Like, he was not waking up. They tried to get him back up.
The district released a statement that read in part, Tomball ISD, as always, will continue to educate our students, staff, and community on the dangerous effects of vaping. The health department will be discussing other local cases this morning. We will be there and have the latest for you at 11 o'clock.
My name is Dr. David Person. I'm the Public Health Authority for the City of Houston. We're here to report to you today that we have got confirmation on what were previously 3 suspected cases of acute pulmonary injury in young people related to vaping. This is something that you reported earlier. It's making national news. And the point of the discussion today is to let everyone know that this is a real phenomenon. It's occurring here in Houston. And we want parents to take close attention to what their children are doing when it comes to vaping. So the cases that we've had have met the profile, as this is a new outbreak which is occurring across the nation. There is lots of work being done by the CDC in multiple states in defining the definition of the case and refining, making sure that what we're looking for, it's all the same thing, and we're doing the stringent epidemiologic work that needs to be done in an outbreak like that. And so we now have confirmation that these 3 cases meet that definition. So they are 3 confirmed cases. It's important to understand that this is, at this point, it needs to be thought of as an injury to the lungs caused by something in the vaping. It is not an infection. It does not respond to antibiotics, and it is very severe. The patients who have this are admitted to the hospital. Many of them are winding up in the intensive care unit, and many of them are winding up on the ventilator with assisted ventilations until they can get through it. Some of those who survive this are winding up with, at this point, looks like some lung injury. Some of the earlier cases, it looks like that injury may heal over time. It's a little bit unclear, and some seem to respond fairly well, but it is definitely a lung injury. The other phenomenon is that this appears to be occurring predominantly in younger people. It's too early to say if there's a physiology difference between younger people and older people, or maybe that the younger people are vaping different substances, or there's some other reason why this is predominantly in younger people. We have seen it up into young adults, in people in their 30s, but it is predominantly people in their teens and early 20s. So this is very serious. The CDC is working with the states to further refine what may be behind this, what's actually causing it. But the message, I think, for everyone to take home is that currently now something has changed about vaping. So before, for decades, from a public health standpoint, we've been warning people about the dangers of smoking tobacco. Vaping came along, and there was a comment made by those who were in support of vaping that it was a safer form of enjoying tobacco products. From a public health standpoint, we've never felt that way, nor do we feel that way today. And in fact, this new phenomenon only reinforces the fact that no one should be taking any sense of feeling secure that because I'm vaping, I'm not being exposed to the dangers of tobacco. Remember, in many of the vaping substances, the substrates that people are vaping, it's nicotine-based. And nicotine is an addictive drug, period. End of story. It is an addictive drug. One of the issues with vaping is that they have lots of flavors and this, that, and the other, and that is unfortunately very appealing to the younger folks. And we're seeing that as much as 20% of high school seniors report that they have experimented with vaping. In Texas, the law is now that in order to sell tobacco products, the person purchasing needs to be 21 years of age, and that includes vaping products. And there's very good reasons behind that. These are nicotine-based products, tobacco-based nicotine products are addictive drugs, and the consequences of breathing in the carcinogens and the other damaging effects from cigarette smoke lead to not only lung cancer years down the road, but also emphysema, hypertension, heart disease, stroke. There are all kinds of negative consequences from it. So this vaping situation is a little bit more concerning if we're seeing an increased number of young people becoming addicted to nicotine and then having to pay the consequences of that years on down the road. In addition, there is some concern about what it is that's in the vaping substances. You'll see the CDC is looking at basically two things. One is it there are places where people can purchase very often over the web or on street corners the vaping liquids that have THC in them, active component of marijuana. And there seems to be, in a lot of the cases, there's reports that the people who became ill were vaping THC-related products. So is it the THC? There is also, we're looking at, the scientists that are researching this, I should say, are looking at a vitamin E analog that is used in there. And vitamin E generally is not a problem. We've used it on our skin, it's in our food, it's generally a good substrate to have in your diet, but it is an oil-based substance, and perhaps that's not so good in your lungs, especially when it's at high heat. So we don't know. So there's a lot of unanswered questions about the science behind what's exactly causing this, but the bottom line is this is a real phenomenon. Parents, you need to look out for your kids, find out what they're doing, educate them that this is dangerous. Vaping is not cool. Cigarette smoking is not cool. And as a society, we need to stop making it look like it's cool because it's getting our children to engage in behaviors that could have serious medical consequences for them later on in life.